Hi, I'm Dr. Kate White, Senior Advisor Active Living at the Heart Foundation. Today I'm presenting a webinar on mindful health, walking our way to vitality and well-being. I'll just share my screen. When the term mental health is mentioned, more often than not, there's a negative connotation attached to it. Especially in the context of Australia, topics concerning mental health and mental illness are still not always well understood or often talked about. As such, it's common that people often confuse mental health and mental illness, combining the two terms and using them interchangeably as if they mean the same thing. Mental health is something that we all have and must take care of, just like our physical health. This is the first point we will cover in the scope of this webinar. The second point is the difference between mental health and mental illness. The role of physical activity in maintaining good mental health, and how much physical activity to do each week. The World Health Organization says that mental health is a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community, but also that mental health is not just the absence of mental disorder. Everyone has mental health. Just as we all have physical health and emotional health, mental health is just one of the types of health that make up who we are. Another definition of mental health is that it's simply about how we think, feel, and behave. It's been said that without mental health, there can be no true physical health. Mental health is often used as a substitute for describing mental health conditions such as anxiety and depression. However, it actually refers to your level of health and well-being or wellness rather than meaning that you have an illness. Mental health or mental well-being refers to our emotions, thoughts, and feelings, our ability to solve problems and overcome difficulties, our social connections, and understanding of the world around us. On the other hand, mental illness refers to an illness that affects and or impairs the way people think, feel, behave, and or interact with others. It's important to note that even though everyone will experience some sort of struggle with their mental health across their life, it doesn't mean everyone will experience a mental illness. Just as we take measures to prevent catching a cold, such as dressing warmly and regularly washing our hands, mental health needs to be nursed and cared for as well. Our mental well-being exists on a spectrum from healthy through to crisis responses. In the healthy range of responses, there's normal mood fluctuations. We're generally physically well. We have few sleep difficulties. When we're responding or reacting, we can be irritable and impatient, have intrusive thoughts and low energy, and may be decreasing in our socializing. An injured or struggling mindset is shown by having a negative attitude, poor concentration, restless, disturbed sleep, and withdrawal, certainly increased fatigue. In a crisis situation, there's angry outbursts and aggression, constant fatigue. There can be addictions and certainly avoiding going out and seeing people. If you know anyone who is experiencing an injured or struggling or crisis state of their mental well-being, please seek help from Beyond Blue by calling 1300 22 4636. Two conditions that can have a negative impact on your heart health are anxiety and depression. Heart disease is the heart condition most closely linked with depression. While less is known about the links between anxiety and heart disease, many people with anxiety also have depression. Depression can affect the recovery of people with coronary heart disease and increase their risk of further heart problems, such as another heart attack. Social isolation, or the state of having minimal contact with others, can also affect your mental and physical health and increase your risk of heart disease. Having social connections, healthy personal relationships, and being part of a community are essential to maintain your mental health. They'll also help you with your recovery should you become unwell. Mental health needs to be nursed and cared for and not taken for granted. It's just like our dental health. It's something that needs to be done daily. Daily physical activity is a key factor in creating a positive state of mind, whilst also being one of the most important actions you can take for your long-term health. When going through a stressful time in life, one of the first things we can reduce or stop altogether is exercise. This can be for multiple reasons. Sometimes it's time commitments that cause stress and anxiety, so people tend to find it hard to reschedule their day to fit in an exercise session. Other times, people lack energy and simply feel like exercise is going to further add to their stress. But physical activity and exercise is so important because it can be a reliable source of improving your well-being naturally. It can make you feel more confident, happy, and relaxed, improve your self-esteem, prevent and help manage depression and anxiety, especially when exercising in nature, can help you sleep better, and can have many long-term health benefits, such as reducing your risk of some cancers and even lowering your risk of dementia later in life. In fact, here at the Heart Foundation, we say that physical activity is the best medicine as it's a one-stop shop for so many benefits. A list that can include strengthening muscles, regulating blood pressure, better controlling cholesterol and diabetes, delaying aging, reducing stress and depression, boosting immunity, improving heart health, increasing lung capacity, fat burning, and promoting bone and joint health. And this list is only the start of the benefits that accrue with an active life. There are many more. A good walk can do wonders for your mental well-being. It improves self-perception and self-esteem, mood and sleep quality, and it reduces stress, anxiety, and fatigue. Physically active people will have up to a 30% reduced risk of becoming depressed, and staying active helps those who are depressed recover. Managing stress, anxiety, or intrusive and racing thoughts is one of the key factors in being physically active and the benefits associated with it. In older people, staying active can improve cognitive function, memory, attention, and processing speed, and reduce the risk of cognitive decline and dementia. When you're feeling unwell, it can be really hard to get started, and it can be frustrating when people tell you about the benefits of being more active. If you're feeling unwell, either mentally or physically, don't be too hard on yourself if you can't be active right now. It can be easy to start feeling guilty or beat yourself up about not exercising, and this can actually contribute to feeling unwell. So you may need to focus on other things for a while and build some physical activity into your routine once you're feeling a bit better. It's important to find a balance and to figure out what works best for you. So how much physical activity do I need? The Australian Physical Activity and Sedentary Behaviour Guidelines state that adults need 30 to 45 minutes at least 5 times per week. This is at a moderate intensity, for example, a brisk walk, where you're breathing harder and perhaps working up a sweat. It's also important to do strength exercises 2 times a week. The more physical activity you do, the better it is. And you can break that physical activity up into smaller bouts, such as 15 minutes 2 times per day, if that's easier to fit into your schedule. The benefits are still accruing and are still as good as if you do one session. And certainly you'll feel better immediately. Our Exercise at Home guide is a free download that helps you to perform strength training exercises in your very own lounge room or in your back garden, and a really useful tool in developing some go-to strategies for regular muscle training and exercise at home. Just Google Heart Foundation exercises to do at home. When you're exercising, remember to drink water and stay hydrated, keep your exercise towel handy, and change into comfy clothes. When you're, if you have problems with your health or if you've had them in the past, it can be hard to stay active, but walking could make all the difference. It's a low impact exercise, so it's easy for you to get involved, even if you're not feeling your best. In fact, walking could help you feel great again. Please talk with your healthcare provider about an exercise plan that's right for you. Get more out of walking with our Heart Foundation personal walking plans. When it comes to exercise, it can be hard to know which advice to trust, how to get started, and how to stick to it. That's why we've created easy to follow personal walking plans that help you be more active, healthier, and happier in just 6 weeks. Our plans are more than information on how and when to exercise. Over 6 weeks will help you experience pleasure in movement and connect with what's going on in the world around you. Confidence in your ability will grow, your strength and flexibility will increase, and you'll generally feel better. Complete the 2-minute form and get your free plan today and walk for what matters most to you. Go to walkingplans.heartfoundation.org.au. How it works. In the personal walking plan page of our Heart Foundation site, you'll complete a 2-minute form. We'll work out the right plan for you based on your current activity level. You'll get your plan straight to your email inbox, and then you'll get moving and feel the benefits. Over 6 weeks, we'll send you information and advice to your email and mobile to help you stick with it. So we have a wonderful Facebook page as well, which you can join when you sign up for personal walking plans. The inspiration there has been really monumental. People are literally changing their lives by joining personal walking plans and getting more active every day. This is a Facebook post from a personal walking plan participant, and there are many, many more like this. For anyone thinking this walking thing is just too hard, please read the following. 2 weeks ago, I didn't even want to wake up or get out of bed each morning. I disliked myself very much and used Facebook to while away my precious time. The first week was hard, but I pushed through it, and now I walk every morning and love it. In the beginning, I didn't believe walking could make much of an impact on how I was feeling. Believe me, it has made a huge impact. I don't care if I don't lose any weight. I'm already fitting into jeans I couldn't even do up. And I'm very nearly 61 years young. Gone are the days when 60 was for old people. To everyone, if I can do it, so can you. Just start. Good luck. So if you're looking at getting more help around your mindful health and walking, or increasing your levels of physical activity, or for more information about mental health treatment and management, or to find a mental health practitioner in your area, we have a number of helplines. Beyond Blue helpline 1300 22 4636, Lifeline 13 11 14. And for Heart Foundation support and advice about physical activity and heart health, you can contact our helpline on 13 11 12. Thank you.